Tomorrow marks National Fall Prevention Day, and as we age, a simple fall really can be very bad. Dr. Forrest Calland from UVA's Department of Surgery is here for today's house call to talk a little bit about this. Now, in your clinic, what's the most common type of patient that you see? What kind of injuries are you seeing?
So every day at the medical center, we see elderly patients who have fallen at home, often patients who are taking blood thinners at home or some combination of anti-anxiety medicines and simply fall from standing because they lose their balance or have a moment of dizziness.
And you know, most of us think, well, just pick yourself right back up and keep moving along, but that can be very, very difficult when you're 80, 85, 90 years old.
Well, the real challenge is the fact that a lot of our aging population has decreased strength and decreased bone and muscle mass. And so the challenges and the consequence of a fall can be actually from a simple fall from standing, a fractured pelvis, spine fractures, skull fractures, bleeding around the brain, just from a simple fall from standing.
Yeah, life-threatening stuff.
Absolutely.
What about the long-term effects of some of these falls that you're seeing?
Well, the most heartbreaking part is the fact that many of our aging patients will, and our community members, frankly, will go from living independently at home to having to go to a nursing home as a consequence of their fall and the rehabilitation process.
That's why it's so important that we talk about preventing these falls. What can people do to prevent that risk?
I think that there are three things that I would point out. Okay. First of all, I'd like to see all of our aging population, I think that includes me as well.
All of us, yeah.
Absolutely.
We hope, right?
Being as active as they possibly can be every day. I know it's challenging, the idea of getting a gym membership or committing to walking every day or an exercise program or something like that, but we really have to do that. Second of all, I think limiting the use of medications that may promote falls has to be acknowledged. This can be medications such as Xanax or other anti-anxiety medicines that simply have the same effect as alcohol.
Sure.
And have to be watched. And then the final thing is that we have a very common injury pattern that we see where potentially homeowners will get up on ladders to work on their gutters or their aerials or something like that. I really want to encourage our homeowners, especially if they're aging, to think about getting a professional to come to the house before they go up on a ladder with a chainsaw.
Because a lot of people say, you know, I've done this all my life, I can still do it, no problems.
And I imagine that there are financial constraints as well to calling someone for help rather than doing it yourself. But frankly, it's just not worth the risk of falling and getting injured when you're just not prepared to get up on top of that ladder.
And that exercise thing you mentioned, that's so key. It's use it or lose it.
Absolutely.
So that's great. Now, you have some sort of seminar coming up right now to talk about this where people can learn a lot more.
Absolutely. There's a community event tomorrow morning from 9 to 10:30 a.m. at the Senior Center on Pepsi Place, a community forum on falls, where we'll talk about strategies for preventing falls. We'll have some of our physicians and experts there to talk to any community member who shows up wanting to know more.
All right. Very important stuff.
Thank you so much.
Thank you so much.